Schizophrenia by Jessica Davis. Schizophrenia facts. Schizophrenia is a disease that is something that affects only 1% of the population in the United States. It also tends to strike young people while they are in the maturing stage of their lives. Symptoms of schizophrenia, such as hallucinations, delusions, extreme disoriented thinking, mood swings, cognitive problems, social withdrawal, obsessive behaviors, self-care issues, work problems, and interpersonal relationships suffer. These symptoms are bad for at least the first 5 years after a patient is diagnosed. Lifespan of the patients, even though things get better if the right treatments are given to the patients, there are still approximately a 10 to 15% of the patients that take their own lives, usually within the first 10 years of developing the disease. Either way, patients have a 25-year shorter lifespan than general population without this disorder because of the amount of side effects from the long-term use of the medication that is given to treat this disease. Treatments. To control the disease, we must look at the dopamine theory and how dopamine in patients cause the disease. Therefore, how it works is in the brain. Dopamine functions as a neurotransmitter, which is a chemical released by neurons that sends signal to other nerve cells. When there is too much dopamine being made inside the brain, the patients start to have symptoms of schizophrenia. That is why antipsychotic drugs tend to block the D2 dopamine receptors in the brain. What the side effects of those antipsychotic drugs can cause? The problem with the antipsychotic drugs attacking the dopamine receptors is sometimes they attack the wrong dopamine receptors from the basal ganglia of the brain can result in coordination and movement impairments in patients. Some of the other symptoms that can be caused from blocking D2 dopamine receptors in patients are dry mouth, dilated pupils, blurred vision, cognitive impairments, constipation, urinary retention, hormone imbalances, and infantility. Conclusion. This is a picture of a normal adolescent's brain and a schizophrenic subject's brain and the annual lossage of memory. Even though there is many different side effects that the medications can cause, it is far less concerning than the problems the patient would have if the disease went untreated. Here is the references for the information used, and here's the references for the images. Thank you.